Over 70% of people with diabetes are deficient in at least one critical vitamin. Today, I'll reveal the 5 most important vitamins and nutrients for blood sugar health, and how missing even one can quietly sabotage your progress. Let's start with magnesium, a true unsung hero when it comes to maintaining healthy blood sugar levels. It's a mineral that often gets overlooked, but its importance in our overall health and specifically in glucose metabolism cannot be overstated. We're going to delve into why magnesium is so crucial and how ensuring you have enough can make a significant difference in managing your blood sugar. Magnesium is a mineral involved in over 300 enzyme reactions within the body. These reactions are essential for everything from muscle and nerve function to energy production and, crucially, blood sugar control. It acts as a cofactor, meaning it helps these enzymes perform their jobs efficiently and effectively. Many of these enzymatic processes are directly tied to glucose and insulin regulation. Magnesium plays a vital role in how your body uses insulin, the hormone that helps transport glucose from your blood into your cells for energy. Without sufficient magnesium, this process can become impaired. Without enough magnesium, a cascade of negative effects can occur, impacting your body's ability to manage blood sugar effectively. It's like a domino effect, where one deficiency can lead to a series of complications. Specifically, your cells become less sensitive to insulin. This is known as insulin resistance, a condition where your body needs to produce more insulin to achieve the same effect of moving glucose into cells. This insulin resistance makes it harder to move sugar out of your blood and into your cells, leading to elevated blood sugar levels. Over time, this can contribute to the development of type 2 diabetes. Low magnesium levels also mean your muscles and nerves can't function properly. Magnesium is essential for muscle relaxation and nerve transmission, and a deficiency can lead to cramps, spasms, and even numbness. As a result, blood sugar levels can swing wildly, making it difficult to maintain stable glucose readings. This instability can be particularly challenging for individuals with diabetes. Numerous studies show that people with low magnesium levels are at a much higher risk for developing type 2 diabetes. The connection is clear and compelling, highlighting the importance of maintaining adequate magnesium intake. Furthermore, a magnesium deficiency makes existing diabetes harder to manage, potentially leading to increased complications and a greater reliance on medication. It's a factor that should be carefully considered in any diabetes management plan. So, what are the best sources of magnesium? Load up on leafy greens like spinach and kale and incorporate nuts like almonds and walnuts into your diet. These are excellent sources of naturally occurring magnesium. Don't forget about seeds, such as pumpkin and sunflower seeds, and the creamy goodness of avocado. These foods not only provide magnesium, but also offer a host of other essential nutrients. And for a treat, indulge in some dark chocolate. Choose varieties with a high cocoa content for the most magnesium benefit. However, modern farming practices often deplete magnesium from the soil, which means that even if you're eating a balanced diet, you might not be getting enough of this vital mineral. So, even a healthy diet might not be enough to meet your magnesium needs. It's a concerning reality that many people face. Furthermore, stress, certain medications, and the consumption of processed foods can all contribute to magnesium depletion in the body. These factors can drain your magnesium stores, leaving you deficient and potentially exacerbating blood sugar control issues. In such cases, supplementation can be a game changer, helping to replenish your magnesium levels and support healthy blood sugar. When choosing a supplement, look for magnesium citrate or glycinate, as these forms are generally well absorbed by the body. Most adults need at least 400 milligrams of magnesium per day to maintain optimal health and support blood sugar regulation. However, it's always best to check with your doctor or a qualified healthcare professional before starting any new supplement regimen to determine the appropriate dosage for your individual needs. Beyond its direct impact on blood sugar, magnesium also plays a crucial role in calming the nervous system, helping to reduce stress and anxiety. And as we've discussed, stress can create a vicious cycle by depleting magnesium further, making it even more challenging to manage blood sugar effectively. Furthermore, alcohol, caffeine, and certain medications can interfere with magnesium absorption and increase its excretion from the body. These lifestyle factors can inadvertently drain your magnesium, potentially leading to a deficiency and impacting your overall health. So pay close attention to these factors if they are a regular part of your lifestyle, and consider taking steps to mitigate their impact on your magnesium levels. Prioritize incorporating magnesium-rich foods into your daily meals, and consider supplementation if needed, especially if you suspect you might be deficient. In some cases, simply correcting a magnesium deficiency can be the missing piece of the puzzle, leading to more stable blood sugar levels and improved overall well-being. It's a small change that can make a big difference. Next up is vitamin D, often called the sunshine vitamin, but it's so much more than that. It plays a crucial role in numerous bodily functions, and we're going to explore its impact on blood sugar regulation. Vitamin D, in reality, acts more like a hormone within the body, influencing a wide range of physiological processes. It's not just a vitamin, it's a key regulator, and one of its most important functions is that it directly improves insulin sensitivity. This means your body can use insulin more effectively to manage blood sugar levels. A deficiency in vitamin D can significantly increase your risk of insulin resistance, making it harder for your cells to respond to insulin signals. This can lead to elevated blood sugar levels. Furthermore, vitamin D deficiency disrupts how your pancreas releases insulin. The pancreas may struggle to produce enough insulin, or the timing of insulin release may be off, further contributing to blood sugar imbalances. Research has consistently shown that low vitamin D levels are linked to a higher risk of developing both type 1 and type 2 diabetes. Maintaining adequate vitamin D is crucial for diabetes prevention and management. Sunlight is the best source of vitamin D. When your skin is exposed to sunlight, it triggers the production of vitamin D. Aim for about 20 minutes a day of sun exposure without sunscreen can help your body produce sufficient vitamin D. Of course, this depends on factors like skin tone and the time of year. However, getting enough sunlight isn't always practical, especially during winter months or if you spend most of your time indoors. Food sources can help supplement your vitamin D intake. These include fatty fish like salmon, mackerel, and tuna. Egg yolks are another source of vitamin D, although the amount can vary depending on the hen's diet. You can also find vitamin D in fortified foods like milk, cereal, and some plant-based milk alternatives. But even with a balanced diet, getting enough vitamin D from food alone is rarely enough to meet your body's needs. For most adults, a daily intake of at least 2,000 IU, international units of vitamin D, is recommended. However, some individuals may need even more, especially if they have a known deficiency or risk factors for low vitamin D levels. The best way to determine your vitamin D status is to ask your doctor for a vitamin D blood test. This simple test can reveal whether you're deficient. When reviewing your results, aim for a level between 50 and 70 nanograms per milliliter, (ng/ml). This range is generally considered optimal for overall health. If your levels are low, consider taking a D3 supplement, and ideally combine it with K2 for better absorption and to support healthy calcium balance in the body. Vitamin D3 and K2 work synergistically to ensure that calcium is properly utilized, supporting bone health and preventing calcium buildup in arteries. Beyond blood sugar regulation, vitamin D also plays a vital role in supporting immunity, helping your body defend against infections. It also reduces inflammation throughout the body, which is beneficial for overall health and can help protect against chronic diseases. And, importantly, vitamin D helps regulate mood, contributing to feelings of well-being and potentially alleviating symptoms of depression. So, if you haven't checked your vitamin D levels recently, it's definitely worth considering. Addressing a vitamin D deficiency could be the missing link you've been searching for to improve your blood sugar control and overall health. Chromium is a trace mineral with a huge impact on blood sugar. It helps insulin move glucose from your bloodstream into your cells. Deficiency is linked to impaired glucose tolerance and higher A1C levels. Food sources, broccoli, eggs, whole grains, nuts, and meats, but modern diets often fall short. Refined sugars and processed foods can increase chromium loss. Chromium picolinate is a well-absorbed supplement. Typical doses range from 201,000 mg per day. Chromium can also improve cholesterol and support healthy weight. Some people notice fewer cravings and more stable energy within weeks of supplementation. If you struggle with blood sugar or cravings, chromium could be your missing link. Omega-3 fatty acids are powerful allies for blood sugar and inflammation. EPA and DHA reduce inflammation, making your cells more receptive to insulin. Best sources: fatty fish like salmon, mackerel, sardines, and anchovies. Plant-based sources like chia and flax provide ALA, but conversion to EPA-DHA is limited. Most experts suggest at least 1,000 milligrams of combined EPA and DHA daily. Omega-3s also lower triglycerides, support cholesterol, and protect your heart. For vegetarians, algae-based supplements provide DHA directly. Balance omega-3s with fewer omega-6 fats from processed foods for best results. Add omega-3s to your routine to improve insulin sensitivity and protect your heart. Vitamin E is a potent antioxidant that protects your nerves, blood vessels, and pancreas from damage. It neutralizes harmful free radicals and helps improve insulin sensitivity. Vitamin E also supports the health of blood vessel linings, reducing risk of complications. Most adults need at least 15 milligrams per day, but many fall short. Best sources: nuts, seeds, spinach, avocado, and quality plant oils. Choose natural mixed tocopherols for supplements. Vitamin E is fat-soluble, so take it with healthy fats for best absorption. Don't overlook vitamin E if you want to protect your nerves and blood vessels. Thiamine, also known as vitamin B1 and vitamin B12, are two essential nutrients that work synergistically in the body. They're like a dynamic duo, each playing a crucial role in maintaining optimal health and well-being. These vitamins are particularly essential for nerve health, playing a vital role in the proper functioning of the nervous system. They help protect nerve cells from damage and ensure efficient communication between the brain and the rest of the body. Beyond nerve health, they are also critical for energy production, helping convert food into usable fuel for our cells. Furthermore, they play a significant role in preventing diabetic complications, which can often arise from nerve damage and impaired energy metabolism. Thiamine helps convert carbohydrates into energy, a process vital for fueling our daily activities and maintaining overall vitality. It acts as a key coenzyme in several metabolic pathways. A deficiency in thiamine can lead to fatigue, making you feel constantly tired and sluggish. More seriously, it can also result in nerve damage, leading to a range of neurological issues. People with diabetes are often at a higher risk of thiamine deficiency, as they tend to lose thiamine faster than individuals without diabetes. This makes it even more important for them to ensure adequate thiamine intake. Vitamin B12, on the other hand, is vital for maintaining healthy nerves and the production of red blood cells, which carry oxygen throughout the body. It's essential for overall neurological function and preventing anemia. B12 deficiency is particularly common among individuals who use metformin, a medication frequently prescribed for diabetes management. Metformin can interfere with B12 absorption in the gut. To ensure you're getting enough thiamine, focus on incorporating these sources into your diet. Pork, sunflower seeds, legumes, whole grains. For B12, prioritize these foods: meat, fish, eggs, dairy. Vegans need supplements to ensure adequate B12 intake, as it's primarily found in animal products. Benfotiamine is a well-absorbed form of thiamine, offering enhanced bioavailability compared to standard thiamine. Methylcobalamin is considered the best form of B12 due to its superior absorption and utilization in the body. Because individual needs vary, dosages of these vitamins should be determined in consultation with your healthcare provider. They can assess your specific requirements and recommend the appropriate dosage for you. Correcting deficiencies in thiamine and B12 can dramatically improve various aspects of your health. Expect improvements in energy levels, mental clarity, and overall nerve health. These benefits can significantly enhance your quality of life. If you're experiencing symptoms such as numbness, tingling sensations, or persistent fatigue, it's crucial to consider the possibility of a vitamin deficiency. In such cases, it's advisable to get your B1 and B12 levels checked through a simple blood test. This can help identify any deficiencies and guide appropriate treatment. Don't let vitamin deficiencies hold you back from achieving better health and living your life to the fullest. Take proactive steps to ensure you're getting enough of these essential nutrients. Deficiencies in these vitamins and minerals can silently worsen blood sugar and inflammation. Get tested, eat a nutrient-rich diet, and talk to your doctor about smart supplementation. Which vitamin surprised you most? Comment below and subscribe for more science-backed health tips.